Sorry.
It's okay.
And then go to final. And scroll up to the top. You can go to the second page.
And here we are.
And here we are.
Thank you very much, Jan. You're welcome. You're welcome and welcome. Would you like to low light any of this so we can see the screen or no? Okay.
Can you see if there's any collars on?
Sure.
If you open it up, you'll see there's people like attending. Hey, we have people on the phone.
Marble Falls.
You guys have some rebound out there. Can you down repeat it until you speak?
I don't know how to fix that either. Maybe can you turn our speaker off and then turn it back on?
This one
Yeah.
over here. I'm not sure.
Just touch.
Right here?
Like it's just touch. You just
No, that's all. Is it this one?
yeah, I want to turn it off.
Yeah, sure.
And then turn it back on.
There you go. It doesn't look like it even did anything. Stinko.
No. Anything. Well, maybe that.
It does charm.
Is it on? Can you guys hear us? Marble Falls. Marble Falls.
Yes, I can hear you.
That's better. Did you guys just mute yours until talking?
The echo's gone. I don't know what you something it worked. It's fixed.
Awesome.
Ready. Coming today. I think I stole your pen, Janelle. Thank you for coming today. We're going to talk about the benefits. Our brokers are here, Higginbotham. And then we've got an Aetna and a Guardian rep here as well to talk to you about the plans. All of your enrollment will be done in iSolve completely electronic. You must log in and do it through your own account. The reason why is it has to have your electronic signature on it. I can see a mirror image in my client user account, but you still have to finish your enrollment through there. If you have any issues, please come by the HR office or call us. We'll be happy to help. And we're going to go over all the differences, your booklets, and the services that their Guardian's offering. And we'll also go briefly over how to find a dental provider for the DHMO plan in Guardian anytime as well. And please feel free to interrupt, ask questions you might have, and you can stay afterwards and ask questions as well if you don't feel comfortable asking in front of everyone, okay?
Okay.
Okay. My name is Lisa, and I'm with Higginbotham here in Austin. I'm the broker for Capital, and I'm going to be going through some of the first parts of this book, and then I'll hand it over for the carriers. So we'll first start out with eligibility. So right now it's your open enrollment, and you have until the 31st to enter your enrollment, new enrollments or changes in iSolve. You can enroll yourself, spouse, domestic partner, and children under the age of 26, regardless of whether they are married or in school. And then your elections will remain in place until this time next year, unless you have a status change. The status changes are listed under qualifying life events, and that could be a marriage, a divorce, birth, death, any of those types of things. If you report it back to HR that you had a change within 31 days, you can go in and make a change to your coverage at that time. If you do not make it within that 31 days, then you will have to maintain that enrollment until the next open enrollment. Any questions on the eligibility piece? All right, we'll go ahead and hand it over to Aetna, and we'll discuss your current plans versus what's being offered as of 10/1. And again, if you have any questions, feel free to let us know.
Thanks, Lisa. Guys, my name is Karen Kane, and I'm with Aetna. And we're going to go over your current plan, and just basically the difference between what you have now and what you can sign up for come 10/1. So the comparison starts on page 4. Right now, you do have 2 plans. You have the base and the buy-up. Both plans offer the same network. The new plans are going to have the same network, which is a large national network. So they both have in and out of network, and I would encourage you highly to always stay in network if you can, because that's where you're going to get the most bang for your buck. But if you have a provider that you know that you just love and it's not in the network, you do have some coverage of that as well. So today we're just going to basically go over the in-network benefits. The current base plan, if you're on that right now, you'll see that it has a $2,000 deductible. The new base plan has a $2,000 deductible. The family deductible stays the same as well. The out-of-pocket, again, this is the amount that the most that you will pay in any calendar year. So if you have a really catastrophic year medically, and you reach this out-of-pocket amount, so current is $6,600. On the new base plan, it's going to be $6,850. Then you would be 100% for the remainder of the year. Okay? So that's what the out-of-pocket is. Okay, so right now, if you're on the base plan, you for your primary care copay, you are paying $35. And you do have a limitation on the $35 copays. That's your first 3 visits. Your 4th visit and subsequent visits goes towards your deductible and coinsurance. On this new plan, that copay, the PCP, is $40 and there's no office visit limits. Okay, so if you go to see your PCP, 6 times a year, you're going to pay that $40 if you choose the base plan for 10/1. Special visits, it's $70 today, and again, it's also combined with those the office visit limitations. On the new base plan, you don't have any office visit limits, but it is a $70 copay after you meet your deductible. So that's the difference on that. Your emergency room, it's a little different too. For the current plan, you're paying 30% after a $250 copay. The new base plan, you would pay 30% after a $500 copay. Now on the generics, they're a little bit different too. So right now you're paying $10 for a preferred generic. You're paying $75 for a non-preferred generic. A brand, you're paying a $45 copay. For preferred and non-preferred at $75. And then if you have a specialty drug, you're paying 30% up to a maximum of $300 for a 30-day supply. Under the new base plan, you actually have a new tier. It's called a tier 1A, or it's your value drugs. And as we go through the booklet, you'll see a list of those value drugs. Those drugs are at a $3 copay. So if you go at any time and get one of these drugs, you're going to pay $3. If you go and get a preferred generic, be a $15 copay. Okay. Now, if you go get any other drug, if you go get a non-preferred generic or a preferred or non-preferred brand, or a preferred or a non-preferred brand specialty, those are going to go towards your deductible first. And then after you meet your deductible, you would pay the copays that are listed there. So that's another difference between the current plan, current base plan, versus the new base plan. So on the buy-up plan today, so you have a $2,000 deductible. On the new buy-up, you'll have a $2,500 deductible. So it goes up by $500. Your family deductible goes from $4,000 to $5,000. Your out-of-pocket for an individual remains the same, which is $6,600. Your primary care copay is $40 versus $35 you're paying today. The specialist copay stays the same, and it's always a copay. It's $70. Emergency room visit is 30% after $350 that you're paying today, and it will, with the new buy-up, be 30% after $500 copay. So then if you look at your prescriptions, again, you'll have that same value 1A, which is our value drugs. that's your $3 copays. Then if it's preferred generics, it's $10. If it's a non-preferred generic, it's $70. And then brand, if it's preferred, it's $35. And if it's not preferred, it's $70. And then specialty, it's preferred is $150. And then the specialty brand is $300. So you'll see the differences in the copays. Under the buy-up plan, all the drugs are strictly always a copay. So any questions just on the differences between the current base and the buy-up based on what you see on page 4?
Does the buy-up have visit limits?
No visit limits. All the visit limits are gone, okay? And one of the reasons that you're having to change plans is because as of 9/1, we did away with some of the old plans, and like that one basic plan that offered the 3 visit limits, it's gone. It's totally gone.
Also, as a reminder, your RX costs will go towards that out-of-pocket maximum as well. It's not just your medical expenses.
It's a really good point. So if that's $6,600, $6,850, that would, your copays, your deductible, all of that goes towards that out-of-pocket limit. Now your deductibles and your out-of-pocket maximum, those are both calendar year. Okay? So it goes from January 1 to 12/31. So even if you're on, let's just say you're on the current base plan and you want to look at going to the current buy-up plan, but you've already met your $2,000 deductible. Then in that case, at 10/1, you would have $500 more that you would have to meet towards your deductible if you had a deductible item expense such as, hospitalization or like an MRI. Okay? If you are on regardless of either plan that you're on now, if you want to stay on the current base, if you want to go, I'm going to choose the current base plan for 10/1 and you've already met your deductible, then you're good until January 1st. Okay? Okay. So on the next page, on page 5, again, this gives you more. This is the current plans as of 10/1. Or I should say these are your new plans, not to add any confusion. Again, they both have in and out of network benefits. The network is your OAMC. That's our large national network. So you should be able to find a provider in the network with no issues. Preventative care, as long as you stay in network, it's 100% paid. And this is like your annual labs, your annual blood work, your well woman exams, your annual physicals. And we want you to go do that. We encourage you to do that. But just also remember when you're going to do that, you can't get there and say, oh, by the way, I've had this arm pain that's really been causing problems. Because if you do that, then the doctor's going to code it diagnostic, and then you're going to be charged the copay for your office visit. So if you're going for your preventative, make sure that you're just doing your wellness checks. Okay. The other thing is your diagnostic X-ray and labs. If you go in network on the on the base plan, it's going to be 30% after your deductible. That's going to be your share. If you do the buy-up, it's 100% in the deductibles way. Okay. The virtual visit or urgent care. So if you're on the base plan, it's a $40 copay. And then if you are on the buy-up plan, it's a $40 copay. Now also look at the difference, the next thing for the emergency care. Look at the differences in the cost between what you would pay going to an urgent care versus an emergency room visit.
So,
sorry.
So you said it's a $40 copay, but that's only for virtual visits. It's a $100 copay for urgent care.
I'm sorry.
Yes.
I got it mixed up. You're right. I'm reading it wrong. So, yes. So she said, if I'm saying the virtual is the teledoc, okay, and we'll go over that in a minute. So teledoc is a $40 copay.
But the urgent care is still $100.
Yes, that's right. Okay, that is for urgent care. Okay, so we're talking about teledoc, and that's your telemedicine. Okay, so that is different than if you go into the urgent care. But anyway, talking about the difference between urgent care and in the emergency room. not only are you gonna save time, but you can also save money, as you can see on this page 5. If it's a true emergency, if it's a life-threatening situation, you think you're having a heart attack, whatever, I would say go to the nearest emergency room as fast as you can. However, if it is something like Saturday afternoon and, you cut your hand and you think you need stitches, then, you're gonna save time and money if you go to your urgent care for that type of service. What I would also tell you to do is that don't wait until you need urgent care to find one that's in network and that's close to you. So what I would suggest that you do, and we've got some flyers along with your book, that one of them talks about your member website, which is the Aetna Navigator. Go ahead and go online. If you don't already have a user ID and password, I would strongly suggest that you do that. That way we can, when you go in, it's going to pull up your information, the plan that you're on, what your deductible is, your claims, etc. But you can go in there and find a doctor, find a hospital, find an urgent care, find one that's in network, and you already have that programmed into your phone so that you know if you need it, where you can go quickly, so you're not like trying to, where do I go? Is it in network or is it not in network and I need medical care?
And be aware of the standalone emergency rooms. They look like urgent cares, but they are not. You will walk in, if it says emergency anywhere, and you're not in an urgent situation, you wanted to go in an urgent care, they will charge you for an emergency room visit and everything that goes along with being in a hospital. So, and also something else to note is, I noticed that most of those emergency rooms, the standalone ones, are 24 hours. Most urgent cares are not going to be 24 hours. And so you'll know the difference if the hours of operation are 24 hours and if there's emergency anywhere listed in the name. As soon as you walk in at the front desk, you'll see that because you will be responsible for that $500 copay and then 30% after on anything that's done during those visits at those standalones.
Right, and that's a good point. Like she says that we're seeing a lot of those emergency centers pop up and are almost on every corner. So, and again, all we see is at Aetna is how they, what they code it as. If they code it like it's an emergency room visit, it's going to go towards, and we're going to pay it to 30% after that bigger copay. So that's a good point. Okay, so if you have hospitalization, any deductible item expense, again, hospitalization, MRI, you're going to pay on your both plans, your base and your bike, you're going to pay 30% after you meet your deductible. Same as like outpatient surgery. We did go ahead and go over the drugs a while ago, so you can, again, the main thing is on the new base plan. Just know you have the two, the tier 1, the tier 1A, which is the value drugs, and then your preferred generics. Those do not, those are just strictly copays always. But anything else, your brand, preferred or non-preferred in your specialty, it goes towards your deductible first, and then you have the copay after your deductible. That's on the base plan only. On the buy-up plan, you have copays the whole time for your prescriptions. We also have mail order available for your maintenance drugs. This is pretty fairly easy to set up. You can go again in the Aetna Navigator and just sign up for that. Basically, you're going to send in a script or have your doctor send in a script. And it's going to, every 90 days, it's going to come to your doorstep. I personally have used this for a long time with Aetna, and it works like a charm. When it's time for it to be billed, they send me a little email notification. They have my credit card on file. I have to say okay, and then the next thing I know, I'm getting 90 days worth of my drugs delivered to my doorstep. Okay, so anybody have any questions there on between what's being offered now as far as the base and or the buy-up? Because you do have the two choices still. Okay, and then the next page again, there are differences in your pharmacy options. Just know, your broker's put some good discount pharmacy options here. Walmart, HEB, Target, GoodRx. if you're, if you have a copay plan, so let's just say you're on the buy-it plan, you always have the copay. If you go to any of these in-network pharmacies, and most of the big retails are in the network for Aetna, then you're going to pay the same copay. But let's just say that you haven't met your deductible yet, and you're going to, you're going to have to, you have to pay the cost of the drug that's in towards your deductible. Then I will tell you that's where I would go on your Aetna Navigator, and again, it's reflected on one of those flyers there for you, that you can go and totally compare the cost of drugs at the different pharmacies and see what it would cost. And literally, I've done that myself, and I couldn't believe the difference. The same drug, what Walgreens is going to charge me versus what CVS was going to. So these are some good pharmacy discounts that's listed on the page. Then the next pages are that value drug list. So these guys are the $3 drugs. So this is online as well. Lisa's included it here, so you'll know. If you are taking one of these drugs, it's going to be a $3 copay. We did go over urgent care clinics a little bit again a while ago. Again, what I can't stress enough is find one that's close to your house and/or your work. And go ahead and get signed. Know where that is. Plug it in your phone, so when you do need it, you'll know exactly who to call and where to go. Now, Teladoc is on page 11. This is I always call it telemedicine. Okay. This is where you can actually call in and you're talking to an actual board certified physician. Okay. So we have general medicine, and then they just last year came up and started offering like dermatology, and also behavioral health services. So this is another thing I would tell you, go ahead and go online and register for this so that when you do need it, they've already had all of your all of your information in there. They have your insurance card. They know your number. All you have to do is call, and they'll go, how are you doing, Ms. Kane? How can I help you? And I typically use this quite a bit versus urgent care. And the great thing is, they can call in a prescription. It's usually within an hour that you can go and pick up the prescription, and then you're well on your way to healing. And again, you just kind of have to know what you got to use this for too. Sinus infections, UTIs. If you know that something like, I know I get sinus infections, and I can tell when one's coming on. Have medication, I can, call them and just tell them. Now, if I do that too much, they're probably going to tell me, you need to go see your primary care doctor, because this is not supposed to be in lieu of your primary care. This is just supposed to help you, when you can't get in to see them.
Is it 24 hours?
It's not 24 hours, unfortunately. I think it's till, I'll have to check, but it's not 24 hours. I want to say it's 7 to 7, maybe. We'll verify that. Okay.
And if you were hired in the past year or so, you probably have heard me say this before. When you're eligible for these, when your benefits go into effect, go ahead and log into these systems, set the account up like she said, because I don't know about you guys, but when I have sick brain, I don't think about things logically. And if I'm struggling with like an electronic system or putting an app on my phone, I'm just not going to think as clearly as I am if I'm not sick. So once you have it set up on your phone and you just have to log in, you can actually you don't have to call them, you just put yourself in a queue and they call you when you're sick. So do it before you need it, and then you won't have to worry about setting anything up and doing the work while you're actually sick.
And those are very good. Okay, and then the last thing I want to go over to real quick is the next page, and I believe that is page 12. A little bit about wellness, the simple.
Good afternoon.
Hello.
You can on your and actually do a health risk assessment. We also have, once you do that, kind of lets us know, that you would be eligible for some of these we have some online coaching programs, and then we can do an outreach and say, do you want to, participate? We have a lot of, programs for, people that want to quit smoking, people that want to, lose weight, just a little accountability factors, where, you can either do it by phone or you can do by video chats. There are some good programs that's available through you being a member with Aetna. So I would encourage you to go online and look at everything that's available and do take your health risk assessment. Okay, so I will be here after the meeting if there's anybody that, wants to talk to me personally, if you've had any issues that you need help with, any questions, I'll be glad to help you.
Well, good afternoon, ladies and gentlemen. My name is Gabriela. I'm with Guardian, and I'm going to go over all the information of the different plans that are available through Guardian. So the one that we're going to be starting with is on page number 13, which is the dental. Now, just a couple of quick tips to think about. There's two different plans. The first one is the DHMO, and I'm going to go over it in the next page with a little bit more detail. Make sure that you understand that is not a true insurance. That is more like a discount program, because it has a schedule of payments, and you have to be assigned to a specific dentist that you would be picking out. If you decide that you want your child to have a pediatric dentist, they can do it. However, you have to pick a main dentist first, and then they will be able to have a referral from that dentist that is within the same network. A second piece of information, that whether it's this plan or whether it's the PPO plan, make sure that if you call a dentist and you ask them, do you take Guardian? Everyone is going to say yes, because they can file a claim that has nothing to do with being in the network or being the one that is assigned to be able to take that particular program, because otherwise you will be stuck with balance billing. Another thing to keep in mind is that if a doctor charges above the usual and customary, you will also be billed the difference. So by that I mean, if there's a certain service that the usual average cost should be $100, and you go to an elite dentist, that charges $130 for the same benefit, then you would be responsible for that balance. So just keep in mind, because the more information that you can get up front, the more, the less billing issues you'll have later. So if you want to go ahead and go to page number 14, and we'll go over the DHMO plan, which is the one that I was just telling you about. That is more, there's no deductible, because like I said, this is not like a true insurance. There is a $5 office visit pay, and if you would like to see a sample, because I do have one with me, of what the listing of the different benefit costs that could be, then you're welcome, to come to me afterwards and I can show it to you, because it's based, like if, for example, like a billing could be X amount of dollars, extraction is an extra amount of dollars, and that's the amount that you're supposed to pay with that designated dentist. Okay. Another thing on the dental, the preferred NAP, which is the PPO, that is a true dental plan. The nice thing about that one is that if you have a family of 5, only 3 of you have to meet the $50 deductible in order, to be able to get the basic or the major work. All of the preventive work is taken care of 100%. If you end up needing basic care, you pay $50 deductible, and then it gets covered at 80%. If you need major work done, you pay the $50 deductible, and then you get covered at 50%. Your annual allowance for this is $1,000. Okay. Now, another thing that I want to let you know, has anybody used this particular plan in the last year?
The DHMO.
No, not the DHMO, the PPO, the one, the true insurance. Okay. Well, just so that you know, we have what's called a dental maximum rollover. So what that means is that there's a threshold of $500 where, let's say that you start your annual plan with $1,000, but you submit $150 in dental claims. If you did not reach that $500 threshold, then $250 of that will roll over into the following year. So what that means is that instead of starting next year with just $1,000, which is your basic amount, then you start with $1,250. And then you can even roll it into the following year, like another $250. So if you didn't use a rollover that you had the year before, then you can go up to $1,500. Okay, so you can go to Guardian anytime to be able to find out who the dentists are that you can go to. That's one thing, and then also to see what your balance amount is for that benefit. Okay. Yes. Yes, go ahead.
Okay, so in iSolve, there's a section, if you select the DHMO, let's say you wanna do the base plan, assuming you wanna do it just for employee only. You have to have a primary care dentist, you have to have their 7-digit PCDID number, so that means primary care dentist ID number. You can find that by going to Guardian anytime, and at the end, I'll show you where you can find it on their website. It can't be a specialist, it has to be a primary care dentist, and you'll put that in iSolve, that's called the primary care physician. We can't change the name of that field, but you'll see a little field where you copy and paste that 7-digit number and you just put it in there. When we do have the feeds up, so Guardian and iSolve will eventually talk to each other without us being the middleman, that number has to be in the system if you choose this dental plan. You can change it, but it won't go into effect until 30 days later because what you're on is a roster. So they have to take your name off of one roster and put you onto another roster. And they pay the dentist ahead of time. So that's why it takes 30 days to change your dentist.
Yeah, it's just to change the dentist, just make sure that you understand that it's not to change plan. So, just for clarification purposes. But yes, once you pick that dentist, you can change it after 30 days, and that dentist is the one that's gonna be able to create that referral for you if you choose that you want, like a pediatric dentist for your child or whatever the case may be. Okay? And we do have a mobile app also, so you can log into the guardiananytime.com and it'll show you how to download that as well. On page number 15, we have the vision coverage. So I want to emphasize that the exam cost is $10. That is not a copay for an office visit. So I just want to make that's clear. You can get an exam once every 12 months. And then there is a copay for $25 for the materials themselves, which is actually the lenses, the frames. On the frames, you have that allowance, $130 once every 24 months. So if you get your exam one year, pay that $10, and then you go the next year, and then you pay the $10 for a different exam, and your prescription is different, then you just take the same frames unless you choose to pay them out of pocket. And then you can just get those lenses changed out. If you decide that you want to get, additional cosmetic, upgrades on your glasses, like progressives or scratch proof or whatever the case may be, you'll be getting a discount on whatever that difference above $130 is. Okay? And the contacts are covered 100% if they are medically necessary. So, okay. On the life insurance, there's a couple of different segments of the life insurance that I want to go over. The first one on page 16, is that your employer is already paying for you to have $25,000 worth of life insurance because you're an employee of this company. So if you pass because of whatever reason, your beneficiary will receive the $25,000. In the event that happens via an accident, then it has accidental death and dismemberment benefit, which means it adds another $25,000. Which means your beneficiary will receive $50,000 in the event of death by accident, okay? Now, you do have a choice of getting some additional voluntary life insurance. Now, with this one and with disability, which we're going to be talking about later, if, let's say, in the middle of the year, you had come in and you had already waived any of these possibilities, and now it's your open enrollment and you do want to get covered, you need to make sure that you fill out the evidence of insurability. And all of that information is going to be available for you in the iSolved, okay? So it's very important that you do that. Or if you're going to increase or whatever the case may be, because they're going to want to know, well, why are you increasing? You can get up to $100,000, and if whatever amount you do choose, your spouse can get 50% of whatever amount you chose, or less. Or whatever, let's say you got $100,000, your spouse can get $50,000. Or they can get $30,000, but they just cannot get more than half of whatever amount you got. Okay, and you can also cover your children as well in increments of 1,000, 2,000, 5,000, or 10,000. This also has the accidental death and dismemberment. So let's say you pick the $100,000 and you pass in an accident, then they get an additional $100,000, making it $200,000. Does that make sense? Mm-hmm. Besides the $25,000 of the original, employer paid amount. Okay. Okay, disability insurance is on page number 17. This is basically, it's insurance on your paycheck. If you can't come to work, you still need to pay bills, usually. I mean, unless, you're just working on Hottie or something, I don't know. So, but it will cover up to 60% of your salary, and it pays on a weekly basis. And the way that it works is that if you become disabled and the doctor deems that you are disabled for 6 weeks, for example, this will kick in on the 8th day of the disability due to an accident or to an illness. So if the doctor says you're going to be out for 6 weeks, well, then after we take out those that first week, then it'll be up until the point that the doctor says that you're medically, disabled. It will not pay the whole 12 weeks. But if it happens to be severe enough that you do become disabled for the entire time, it can pay up to the 12 weeks. Okay?
So
And-
if I could, that's one of the reasons you want to be careful with your PTO and your medical time off. It starts on the 8th day.
Mhm.
That's a week period where there's no pay unless you have something to fall back on, like your PTO or medical that you haven't used. That's why it's called paid time off instead of vacation. It's for you to use in any way you like. But one of the things to keep in mind is for a week, there will be no pay. And so if you've got anything in the bank, that helps.
Absolutely, thank you for putting that out there separately. And then also another thing, keep in mind that all of your census information is in iSolved already. So like your salary information, your dependent information, date of birth, et cetera. So it's going to be based on your income. Because earlier we had a question, somebody that wanted, I wanted to get the full 1,500. Well, that wasn't applicable to their salary because that's not their 60%. Does that make sense?
Mm-hmm.
So I just wanted to make sure that that was clear. It doesn't mean that you can just pick the highest amount and,
And they will actually ask for your W-2 from the previous year. So
And that's how they base it.
that's how they base it. So if you want to be able to calculate, if you want to have like a realistic idea of your weekly benefit so that you can elect this, you can take your W-2 from last year here, and you can divide that as long as you work for the full year. By 52 weeks, and then multiply that times 0.6, and you'll get the amount that's the closest to $50 increment of what you can elect, or what they will award. But the system is smart enough, and it should know how much you make, and it shouldn't let you elect more than what your 60% is. So we did change that this year, so you should be able to only elect up to that amount. If it stops at 1,500, that means that that's the max that anybody can elect, and that your salary fits that category.
Okay, on page number 18, this is the college tuition services. So if you have enrolled in any of the Guardian plans, like the Guardian NAP, which is the PPO, the Vision, the Life, or the Disability plans, you're eligible to receive this benefit. And so this is a fairly new benefit that there has been a lot of questions that come up about this. So basically, each tuition reward point equals one tuition dollar reduction. So based on the benefit amounts that you use, that accumulates points, kind of like a rapid rewards or miles and that kind of thing. But it can go towards tuition of colleges or universities. There is a website link to make sure that you register your student here. And this can go for your relatives, including children, nephews, nieces, and grandchildren. Okay. Now, there is also a phone number on here that you can call and ask in case there's a university that is not listed on the website because they don't update it every single day. You can always call that number and they can verify which college is available for this benefit. Now, to clarify, the students must be registered before completion of the 10th grade, and the rewards would have to be pledged to the students in the 11th grade. Okay, so the deadline for registering whatever student you want to enroll in this program is August 31st. Now, it's not retro in that if the child is already in 12th grade, then they need to have registered before the 11th grade. So, but if you already have accumulated points, you can use them as long as they're not like already in 12th grade. Does that make sense? Any questions on that? Did that clarify? Yeah, so you can use them. Just if you have them, you can use them.
Like we have.
Do the kids have to be enrolled in the program?
I'm sorry.
Into the dental program?
Does the child have to be enrolled into the dental program?
No, because this can actually be your nieces or nephews or grandchildren, which usually would not be covered under the plan.
So this
is based on the employee use of those plans, of the employee that has been registered under those plans.
So I have a question. if I ever wasn't in Guardian and I had accumulated 10,000 points, can I still have those?
If
Can
you were
I use
not
them later?
enrolled in Guardian,
So
you
like,
couldn't have had accumulated
so
points.
no, if I was enrolled for a period of time and I accumulated like 10,000 points, but then I was out of Guardian after that, could I still use those points I had accumulated?
That is more specific question that we will probably have to take on a one-on-one basis, because that's not usually the case, because if somebody leaves, I think that it forfeits because it hasn't been used and basically you fell off the plan. But, we can verify that information, or you can call and ask for, it's kind of like the life insurance, because the life insurance, by the way, is also portable. You can take it with you, but the rate that ends up being at is going to depend on how old you are, how long have you been here, how much insurance that you have, So it's going to be a little bit more on a one-on-one basis that can make a difference on. Does that make sense? Okay. Now, under value added services on page number 19, we do have the will prep enrollment. So one of the things that I want to touch base on, like on the life insurance, whether you choose to get the voluntary one or just put the beneficiary for the one that's employer paid, make sure that you understand that if you're married and the state of Texas is automatically your spouse, unless they sign a waiver that they choose that they do not want to be, because that's just that Texas is a common law state. That's one thing. Second of all, if you have children that you want to put as beneficiaries, keep in mind that if they're 10 years old and you put them as a beneficiary, they won't be able to do something if something happens to you in December. So it is highly recommended that you choose whoever you're going to have as a beneficiary to be whoever's going to be in charge of your kids, or you can go through the will prep services. Especially if you were already enrolled, you could probably call and ask beforehand, hey, how do I set up a trust, or how do I set up, if I want my best friend to take care of my kids and take care of this money for them, or this is how I want to get my funeral arrangements taken care of, etc. Just make sure that the person that you name as a beneficiary, if you're not married, that it's somebody that will know, obviously, that they're the beneficiary, and two, that they're old enough to be able to take on that responsibility. Okay. Because I know that a lot of times we get people that prefer to have their kids, which is understood. But just, take advantage of the will prep services, because this can help you like with taxes to set up trusts, to set up wills and living wills, etc. There is a website, there's a username and a password. So if you look in the bottom of that column, just make sure that you log in there and register and take advantage of that service that's completely free to you, okay? The second part is a Work Life Matters, which is the employee assistance program. This is something that is available 24/7. So in the event that you choose that you need help, for work-life balance, stress, drug addiction, alcohol abuse, whatever it is, just marriage problems, whatever the case may be, please know that this is 100% confidential. Nobody in this room or employer or anybody is ever going to know the reason that you called. Okay, so just make sure that you take advantage of that, and that also has a website login and password for you to be able to use. So there's a lot of information that is available to you. If you have financial legal issues, if you want to fix your credit, there's a lot of things that you could potentially use that for. Okay. So, and then last but not least, if of course you know that on page number 20 you have all of the rates listed, and all of that information based on your census information will be in the iSalt. And keep in mind on page number 21, I would probably do a little rabbit ear on this one or something, because it's got all of the contact information of all of the carriers, and depending on the plan that you have a question on, in case we're gone and you think of something else that you may need to know. Thank you very much.
Does anybody have any questions that you would mind saying out loud? If not, no questions, then what we'll do is we'll just end now, and then they'll be around for a couple minutes for you guys to chat with them directly.
All right.
No questions? All right.
I have a question for the health person, if they can hear me.
For who? Help.
For the medical health.
Okay.
I can hear you.
If we've already met our $6,600 out of pocket, if we go up to the buy-up plan, would everything still be paid for the rest of the year?
Okay, so you do get credit for what you've already met for your out-of-pocket, and I'm just looking to make sure I'm telling you the right numbers. If you go to the buy-up, and that's, I think, $68.50. Hold on just one moment.
I think that's
$6,600. So yeah, so if you've already met your out of pocket, and it's the same for the buy-up, the $6,600, then you are totally out of pocket, and you would be covered at 100% until January 1.
Okay, thank you.
Welcome.
Any other questions, guys? No?
No.
All right. Well, thanks for your time today, really appreciate it, and please stop by the HR office or give us a call if you have any questions or if you need help with your enrollment.
All right. Thank you.
Thank you all.
There we are. Yeah.